Hello everyone, it's good to see you again in this video. Today we're going to talk about something no one wants to hear about. But even if we avoid it, it still exists. That's why I made this video to share knowledge about this serious illness so we can understand it better, face it bravely, and prevent it while we are still healthy. I'm Dr. Mark. For 30 years every day I walk into the large hospital where I work and see the anxious faces of patients and their families. Some have been coughing for months. Some just feel tired or have vague chest discomfort. Some have never smoked a single cigarette, and others quit decades ago. Yet when they come into my clinic, they all share one thing: fear. And you know, that fear isn't just about the disease called lung cancer. It comes from uncertainty, from confusion, from wandering in the dark of information. Let me start with a story. A few years ago, a patient named Linda came to see me. Linda, a woman in her 60s, kind of retired elementary school teacher. She came because of a persistent cough, no fever, no blood, just a hoarse, lingering cough like wind whistling through a winter crack. She told me, "Doctor, I think it's just a sore throat. But why won't it go away?" We ran tests, CT scans, biopsies, and finally the results showed early-stage lung cancer. She was shocked. Her family was shocked. And as always, I sat down, looked into Linda's eyes and said, "Linda, I know this is scary, but at this stage, we still have a very good chance to cure it." You see, many people discover the disease early just because they didn't ignore the small signals from their bodies. But there are other stories. A man named Robert, 67, a former Marine, tall and strong. He came to me later. By then, the tumor had spread to the other lung, and small spots appeared in the brain. Robert looked at me, voice hoarse, "Doctor, I've fought all my life, but now I'm scared." Moments like that make me wonder, why do some find it early and others late? Is it the symptoms, the habit of seeing doctors? Or is it because we rarely pay attention to our lungs, the silent workers keeping us alive every day? Today, I invite you to sit down, take a deep breath, and talk about lung cancer, not with cold medical terms, but with the language of heart, truth, and hope. We'll go from the big picture to the details. Telling lung cancer apart from pneumonia, cystitis, asthma. Understanding the types of lung cancer, each with its own character. Why does lung cancer form? What happens inside your lungs when normal cells suddenly rebel? How dangerous is lung cancer really? What does it take from us and when? And most importantly, how to prevent it. From quitting smoking to eating healthy, from exercise to regular screening, all within your reach. Have you ever wondered, can a healthy breakfast really lower lung cancer risk? I quit smoking. Am I safe now? And if one day the doctor tells me I have a tumor, how long do I have? These are the questions my patients bring to the clinic every day. And today I bring them here to this camera to find answers with you. Imagine this. One morning you wake up, take a deep breath, and realize your lungs have worked non-stop for 60, 70 years. Every minute exchanging oxygen, filtering air, keeping you alive. But have you ever truly listened to them? Most of us only notice our hearts when they hurt, our stomachs when they burn. Our lungs, they work silently until a small shadow appears on an X-ray whispering, "I need your attention." From my experience, the scariest thing about lung cancer isn't just the disease, it's its silence. It can grow for years without clear symptoms. And when fatigue, cough, weight loss appear, sometimes it's too late for if only. But science today is different. We have low-dose CT, LDCT for screening, targeted drugs, immunotherapy, helping patients live longer, better than 10, 20 years ago. I've seen patients like Linda, early detection, timely treatment, return to normal life. And I've seen people like Robert, even with advanced disease, get extra precious years with their families, thanks to new treatments instead of just months as before. You see, the story of lung cancer isn't just about medicine. It's about families, about dinners with laughter, about holidays together. It's about choices, the choice to quit smoking, to get screened, to live healthier. And above all, it's about hope. So in this video, I invite you to come along, not as doctor and patient, but as two friends on a porch, sipping tea, talking about lungs, about how to protect them, care for them, and if illness comes, how to fight without losing hope. Are you ready? Let's begin. First, let's talk about how to tell apart lung cancer, lung cysts, pneumonia, lung collapse, and asthma. Dear friend, when it comes to lung diseases, many people hear the words lung cancer and immediately panic. I've seen countless patients come to me, hands trembling, with an X-ray or CT scan in hand, with only one expression on their faces: anxiety. I remember a man named James, 62, who came to see me with red eyes. In his hands was a CT report saying a nodule in the upper right lung lobe. He couldn't hear anything after the word nodule. He asked him, "Doctor, does this mean I have cancer?" But the truth is not every nodule in the lungs is cancer. Some are benign cysts, some are infections that go away after antibiotics, some are lung collapses due to blockage, and of course some are chronic conditions like asthma, causing long-term cough and shortness of breath. Today I want to help clear up all these concepts gently, like two friends chatting on the porch, so you won't panic if one day a doctor says you have a lung nodule. Lung cancer, when cells rebel. Let's start with lung cancer, the main character of today's talk. Imagine your body as a giant factory with billions of workers. Normally, when a worker gets old, they retire. That's cell death. New cells replace them. But sometimes a worker refuses to retire. He keeps multiplying, ignoring all rules. These rebel workers gather, grow, and take over space from the healthy ones. That's cancer. In the lungs, when bronchial or lung tissue cells start growing out of control, they form a malignant tumor. The danger is early on. They're silent. No pain, no fever, nothing obvious. Symptoms appear only when the tumor grows: big blocks, airways, or spreads, persistent cough, coughing, blood weight loss, chest pains, shortness of breath. I once had a patient, Maria, 58, never smoked, healthy lifestyle. She came in for a 3-month cough thinking it was allergies. CT scan showed a small nodule. Biopsy confirmed early-stage lung cancer. She was shocked. Her family was shocked. But because it was found early, we did surgery and additional treatment. 5 years later, Maria is still healthy, gardening, playing with her grandkids. This shows lung cancer is serious, but not always hopeless. The key is to tell it apart from other diseases and find it early enough to cure. Lung cysts, harmless imitators. Many patients come scared about cancer, but only have lung cysts. A lung cyst is like a small air or fluid-filled sac. Most are benign and cause no symptoms, often found by accident on x-rays done for other reasons. One patient, Henry, 65, came after slipping and getting a CT to check his ribs. Report 1.5 mm air cyst in left lower lung. He panicked. "Doctor, is it cancer?" I explained, "No, Henry. A cyst is different. We monitor it. If it doesn't grow, has smooth edges, no abnormal PET scan uptake, we usually don't touch it." He left relieved, and next visit he came only to show pictures of his grandkids. The point: not every lung spot is cancer. Doctors use imaging, location, growth rate, PT, CT features to decide whether to biopsy or just observe. Pneumonia, the fever maker. Unlike cysts or cancer, pneumonia is infection. Bacteria, viruses, sometimes fungi invade lung tissue, causing fever, chills, cough, with phlegm, shortness of breath. A patient, George, 70, came with 102 fever, coughing, yellow sputum, breathing hard. X-ray showed a cloudy patch. People feared cancer, but after 1 week of antibiotics, it disappeared. Pneumonia comes fast, responds fast. Lung cancer grows slower, rarely causes high fever, doesn't vanish after a few pills. Lung collapse, when the lung falls down. Another confusing condition, lung collapse, atelectasis. A lung region collapses due to blockage, mucus tumor, foreign body, or external pressure fluid mass. X-ray may show a cloudy area like a tumor, but it's just collapsed lung, not cancer. I recall Daniel, 63, coughing after severe flu. X-ray shadow in right lower lung. He panicked, but bronchoscopy found a mucus plug. After removal, lung reinflated normally. See, sometimes it's just a fallen lung, not an invader. Asthma, mirror. The whistling chest. Finally, asthma, chronic airway inflammation and narrowing. Patients wheeze, cough at night or early morning, feel breathless. One older patient, Susan, 68, long-term cough and wheeze, feared cancer, but it was uncontrolled asthma. After inhalers with bronchodilators and steroid, symptoms improved greatly. Asthma isn't cancer. It's chronic but manageable if treated properly. Key takeaways. Don't panic over lung nodule or lung lesion. Let specialists interpret with exams, imaging tests. Many cases are benign or fully treatable. I often tell patients, not every shadow on a scan is a storm. Sometimes it's just a passing cloud. Have you ever felt that fear, persistent cough, doctor says lesion, and your world collapses? Remember, modern medicine is different now. We have low-dose CT, advanced bronchoscopy, precise biopsies. Doctors can tell benign versus malignant infection versus cancer with just a few steps. And if it is cancer, early detection still gives the best chance for cure. Part 2. Types of lung cancer. Each invader with its own personality. Dear friend, When people hear lung cancer, many think it's a single disease. Like when we say tree, people picture a trunk and leaves, but there are big trees, small trees, flowering trees, shade trees, each with different shapes, growth speeds, and vitality. Lung cancer is the same. Under the microscope, pathologists see that not all tumors are the same. Some grow slowly, spread less, and can be cured if found early. Others are aggressive fast and need completely different treatment strategies. Understanding which type you're facing is the first step toward a personalized treatment plan tailored to you, not one size fits all. Two main families of lung cancer. In medicine, we divide lung cancer into two main families. Non-small cell lung cancer, NSCLC. Small cell lung cancer, SCLC. The names sound like just big or small cells, but behind them lie very different stories about speed treatment and prognosis. Let me share real patient stories so you can see how these two families differ. NSCLC, the majority but diverse. About 80–85% of lung cancers are NSCLC. This group includes 1. Adenocarcinoma, 2. Squamous cell carcinoma, 3. Large cell carcinoma. But don't worry, I won't give you a dry lecture. Let me tell you about Sarah. Sarah's story, adenocarcinoma, the silent type. Sarah, 59, never smoked, worked as an accountant, lived healthily. One day during a routine checkup, a CT scan found a 1.2 centimeter nodule in her right upper lung. Biopsy, early stage adenocarcinoma. Adenocarcinoma often appears in non-smokers, especially women. It grows slowly, quietly, no dramatic coughing, blood, no severe pain. Just a small shadow on CT. We did surgery and follow-ups. 5 years later, Sarah is healthy, even hiking with her grandkids. It shows early adenocarcinoma has a high cure rate. Squamous cell carcinoma, the smoker's cancer. Tom, 68, smoked for 40+ years, came with coughing, blood. CT showed a mass near the lung hilum, classic squamous cell carcinoma. It links strongly to smoking, often grows in major airways, causing cough and bleeding. Tom needed chemo and radiation because it spread to lymph nodes. He quit smoking, followed treatment, and lived many more years with family. Large cell carcinoma, rare but unpredictable. Less common, grows fast, harder to classify, worse prognosis if late. David, 61, had a large tumor, but genetic testing showed EGFR mutation, so we used targeted therapy, improving survival beyond standard chemo. SCLC, the aggressive but treatment-sensitive type. SCLC is only 15–20% of cases, but extremely aggressive. Marcus, 65, had rapid weight loss. CT showed widespread disease in weeks. CLC spreads fast, often within 2 to 3 months from local to extensive, but it responds well to chemo and radiation. Marcus improved after 4 cycles, though relapse risk stays high. Genetic personalities in modern medicine. Today we test tumor genes, EGFR, KRAS1, CRISPR-MET. If mutations exist, targeted drugs, pills with fewer side effects work better than old chemo. One 55-year-old patient with EGFR mutation lived years on targeted pills with excellent quality of life. Modern medicine is like using guided missiles instead of carpet bombing. Carcinoid, the slow tumor. Rare, slow-growing, less aggressive. I once removed a lung carcinoid from a 50-year-old. 10 years later, no recurrence. Not all lung tumors are death sentences. Why classification matters. You may ask doctors, so many types, does it matter? Yes, because type decides surgery, chemo, radiation, targeted, or immune therapy. Growth speed affects monitoring strategy. Gene mutations guide precise drugs, fewer side effects, longer life. As I tell patients, each lung cancer type is like a book. Read it right, and we can write the next chapter of your life. Science now brings more hope than ever. Compared to 20 years ago, we have targeted therapy, immunotherapy, precise radiation, extending life and improving quality for thousands. So now you know lung cancer isn't one single disease. Many types, many personalities, many treatment paths. Next, we'll explore, why does lung cancer form? What makes normal cells rebel? The answer helps prevention and early detection. Let's continue this journey together. Why does lung cancer form? When cells rebel in silence. In the last 2 parts, we discussed distinguishing lung diseases and types of lung cancer, each with its own personality. But perhaps the question most people care about is, why did I get lung cancer? I hear this almost every week from patients and their families. Some ask in trembling voices, some in anger, some searching for a ray of hope. Doctor, I eat healthy. I quit smoking years ago. Why me? Each time I sit down, look them in the eye and speak slowly. Lung cancer doesn't come from a single cause. It's the result of many factors: lifestyle, environment, genetics. and sometimes things beyond our control. Today, let's open this door together to understand why normal cells silently rebel and become cancer. Paul's story, the man who never smoked. Paul, 61, construction engineer, suburban resident. Never smoked, ate well, jogged every morning. One day he came in for a persistent cough, CT scan nodule in left lung, biopsy, adenocarcinoma. Paul was devastated. Doctor, I never smoked. Why me? Paul's story isn't rare. Today, 15–20% of lung cancer patients in the U.S. never smoked. Many are women. Smoking is the #1 cause, but not the only one. Smoking, public enemy, #1. Over 80% of lung cancer cases linked to smoking. Cigarette smoke has 70+ known carcinogens, benzoprine, nitrosamines, formaldehyde. They attack lung cell DNA, creating mutations. Imagine DNA as a cell's instruction manual. Every puff tears or rewrites pages. At first, the body repairs them, but after thousands, millions of hits, errors escape control. Cells multiply recklessly, lose self-destructibility. Cancer begins. I told a patient once, smoking is like poking a tiger again and again. One day it strikes back, but it doesn't stop at cigarettes. Secondhand smoke, the innocent victim's risk. Lisa, 55, worked 20 years in a smoky bar. Never smoked herself, but inhaled it daily. Last year, stage 2 lung cancer. She cried, I never smoked, but I worked there all my life. Secondhand smoke carries the same toxins as active smoke. Kids in smoking households face higher respiratory and cancer risks later. Quitting protects you and those you love. Radon, the invisible killer at home. Few know about radon, a radioactive gas from soil and rock building up in basements. EPA ranks radon #2 cause of lung cancer, #1 in non-smokers. One Pennsylvania patient tested his home 4x above safe limits. Installed ventilation, reduced risk for the whole family. Radon is colorless, odorless, yet damages DNA silently over years. Air pollution, danger in every breath. City smog, PM2.5 particles raise lung cancer risk, especially adenocarcinoma. WHO labeled air pollution a carcinogen in 2013. A truck driver patient told me, Doc, my lungs worked overtime my whole life. Occupational hazards, toxic workplaces. Miners, asbestos workers, metal smelters. Chemical industries exposed to asbestos, arsenic, nickel, chromium face higher risks. I treated shipyard workers. Decades later, many had mesothelioma lung cancer. Safety gear saves lives. Genetics, inherited vulnerabilities. Some inherit DNA repair defects or higher cancer sensitivity. 2 sisters I treated, non-smokers, shared a rare mutation. Both developed lung cancer. Family history matters for early screening decisions. Chronic inflammation and lung disease. COPD, pulmonary fibrosis, repeated infections, chronic inflammation raises risk. Like wounds, never healing cells keep dividing to repair. Each division risks errors. Lifestyle, the final piece. Processed meats low, fruit, veggies, sedentary life, obesity, alcohol, all increase cancer risks. Healthy diet with greens, fruits, whole grains, fish reduces inflammation, strengthens defenses. When cells rebel, a simple science view. All factors: smoking, radon, pollution, genetics damage DNA. Oncogenes turn on, tumor suppressor genes switch off. Cells escape control, multiply endlessly, dodge immunity, grow, blood vessels spread. Silent for years until symptoms finally show. What can you do to us? And can you do? Worried now. Quit smoking. 10–15 years later, risk halves versus continuous smokers. Test radon, fix ventilation if high. Eat healthy, exercise, use workplace protection, lower inflammation, boost immunity. High-risk group, annual low-dose CT screening catches early curable stages. Lung cancer isn't one cause, it's multiple: environment, lifestyle, genetics, even chance. But we're not powerless. Quitting testing homes, healthy living, regular screening cut risks dramatically. Next, we'll discuss lung cancer's dangers, not to scare you, but to show why early detection matters so much. Now we move to part 4. How dangerous is lung cancer when the silent enemy enters your life? Dear friend, I remember a man named Robert, 67, pale face, hoarse voice. He said, Doctor, I think it's just bronchitis. Coughing for a month, a bit tired, but nothing serious. But his CT scan showed a 4 cm tumor in the right upper lung, spreading to lymph nodes. Biopsy, stage 3 lung cancer. When he got the result, Robert sat silently for a long time. Then he asked, Doctor, is it very dangerous? The danger isn't just the tumor. Lung cancer is dangerous not only because of tumor size, but its silent invasion before you notice. The lungs work quietly, no dramatic pain like ulcers, no yellow skin like hepatitis. They exchange oxygen silently until cancer takes over. When coughing, blood weight loss, chest pain appear, cancer is often far along. Why is lung cancer often found late? Patients always ask doctor, why didn't we find it earlier? Reality, naponinor, early stages have almost no clear symptoms. Cough, fatigue, weight loss, blamed on infections, age, weather. People ignore it, it'll go away on its own. Only when tumors block airways, invade pleura, or spread far does the body cry for help, often too late for cure. The silent paths of metastasis. Lung cancer spreads by blood to brain bones, liver, adrenal glands, nourish, P, lymph to chest, neck nodes, local invasion, pleura, chest wall, heart. Evelyn, 62, learned she had lung cancer after MRI for headaches showed brain metastasis. She never knew it was in her lungs. Warning symptoms, don't ignore them. I tell patients, coffee 3 weeks, coughing, blood, rapid weight loss, chest pain, shortness of breath. Don't wait, especially a 50 smoker or ex-smoker. A simple X-ray or low-dose CT can save your life. Survival rates, numbers speak loudly. American Cancer Society data. Localized lung cancer, 5-year survival, 56%. Spread to nearby nodes, 30%. Distant metastasis, 10%. Early detection, much higher survival. When disease advances, Martin's story. Martin, 70, retired gardener. Ignored cough for 6 months, lost 8 kilos on breathless climbing stairs. CT, large tumor, liver, and bone metastasis. He asked doctor, how long do I have? We started chemo plus immunotherapy. Not curable, but Martin lived 2 good years gardening, seeing his grandson enter college. Lung cancer doesn't always end hope immediately. Modern science extends life even in advanced stages. Dangerous complications. Lung cancer may cause pleural effusion, severe breathlessness, SVC syndrome, facial swelling, vein compression, brain metastasis, headaches, seizures, weakness. Bone metastasis, fractures, chronic pain. One patient fractured his thigh. Just standing up, cancer had weakened his bones like dry twigs. Screening, changing the game. People ask doctor, can we find it earlier? Yes, low-dose CT detects lung cancer early before symptoms. U.S. guidelines recommend annual screening for an age 50 ET. Unin are 20-pack year smokers, Subranaturanun, current or quit 15 years ago. Many lives saved by early surgery instead of late chemo. Silence, the greatest enemy. Lung cancer kills silently, no dramatic pain, no high fever, just persistent cough, mild fatigue until stage 3 or IV. I tell my students lung cancer is like a thief at night. It comes while everyone sleeps. But science is changing the game. 20 years ago, stage IV patients lived months. Now with targeted drugs, immunotherapy, precise radiation, many live 5, 10 plus years with good quality. I've seen patients travel, play with grandkids, even paint while on advanced cancer treatment. Early detection remains key, but modern treatments bring hope even late. A message from the heart. Dear friend, lung cancer is dangerous, true, but fear grows with ignorance and late discovery. If you or loved ones, 50 smokers or ex-smokers, ask about screening. One low-dose CT yearly can save lives. If already diagnosed, remember modern medicine offers more options than ever. It's no longer an instant death sentence. Next, we'll discuss prevention through diet, exercise, lifestyle. Because prevention beats cure, and you can start today with small changes. Let's continue this journey together. Part 5, how to prevent lung cancer. From simple meals to every breath you take. When people talk about lung cancer, they often focus on diagnosis and treatment. But today, I want to look at it from another angle, how to prevent it so it never knocks on your door. After 30 years as a doctor, I've learned something important. Health isn't just in a doctor's hands, it's in your daily choices. The cigarette you put down, the food you pick up, the steps you take each morning, they all matter. So today, let's talk like two friends on a porch, sharing tea about how to live so your lungs stay healthy. Linda's story, a life changed after one cough. Linda, 60, came in for a persistent cough, thankfully benign. I told her, Linda, you were lucky this time. But if you keep smoking, stay inactive, eat poorly, next time might not be so lucky. A month later, she returned. Doctor, I quit smoking. I started walking daily. I'm growing vegetables and eating healthier. 3 years later, 12 kilos, lost stable blood pressure, vibrant health. She laughed. I feel 10 years younger. I never want to meet you in the cancer ward. Prevention begins with small steps. Step 1. Goodbye to cigarettes. Many tell me, doctor, I quit too late. Truth, it's never too late. Quit today. After 1 year, heart disease risk cut in half. After 5 years, stroke risk like a non-smoker. After 10-15 years, lung cancer risk drops 50% versus continuous smokers. James, 65, quit after 40 years. 5 years later, lungs improved, breathing better, no cancer diagnosis. Start by avoiding smoky places. Seeking help from doctors, quit groups nicotine therapy. Reminding yourself each cigarette skipped, Shukungoy one healthier breath tomorrow. Check for radon, the invisible threat at home. Radon gas, second leading cause of lung cancer in the U.S., comes from soil invisible, odorless builds up in basements. A family in Iowa tested their home 3x above safe limit. Installed ventilation risk reduced, lives protected. Sometimes a simple radon test can save a life. Healthy eating, turning meals into medicine. Food doesn't replace medicine, but the right food may keep you away from it. Research shows greens, fruits, whole grains. Antioxidants reduce inflammation, protect DNA, fish, nuts, olive oil. Omega-3s support heart and lung health. Limit processed meats, fried, salty foods. Reduce chronic inflammation. Maria, after losing her husband to lung cancer, changed diet, more produced fish, 2-3 weekly, no fried foods. 5 years later, healthy, stable weight, normal BP and glucose. She said, I eat to live well, not just to fight disease. Exercise. Let your lungs breathe fully. Protect lungs by moving daily. Walk briskly, 30 minutes. Deep breathing, inhale. 4s, hold 2s, exhale 6. Gentle exercise, yoga, cycling, swimming. Studies show physical activity boosts lung capacity, immunity, cuts cancer risk. Peter, 70, once breathless after 5-minute walk. A year later, climbs 2 flights without resting. He laughed, Doctor, I feel younger. Avoid pollution and toxic chemicals. City living. Wear masks in traffic hours. Use air purifiers indoors if possible. Plant trees around homes for cleaner air. Industrial workers always wear protective gear. A cement factory improved filters and gear, respiratory illness rates dropped dramatically. Keep stress low, the priceless medicine. Chronic stress harms immunity, health overall. One stage 2 lung cancer patient after surgery joined meditation and yoga groups. Better sleep, faster recovery. She said, I learned to breathe slower, not just for lungs, but for peace of mind. Screening, the golden key of prevention. Over 50 smoking history, ask about annual low-dose CT. Early detection, your higher cure rates. One man's 1 cm tumor found early. Surgery, 5 years, cancer-free, fishing weekends happily. Common questions patients ask. I quit smoking. Am I still at risk? Does diet really help? Sonner, how much exercise is enough? My answer, no one erases all risk, but each change is one step closer to health. Final message, prevention isn't a one-day task, it's lifelong. Quit smoking today. Shuras. Eat healthy meals tomorrow. Walk next week. Laugh more, worry less. Every small act is a shield for your lungs. Next, we'll discuss who's at highest risk for lung cancer, so those needing early screening can act in time. Because knowing your risk is the first step toward protecting your health proactively. Who is at high risk for lung cancer? Recognize it to protect yourself. Dear friend, in the last section, we talked about prevention, quitting, smoking, healthy eating, exercise, and screening. Today, let's go deeper into an important question. Who really needs to pay the most attention? Because the truth is, not everyone has the same risk. Some people smoke all their lives and never get lung cancer. Others never touch a cigarette yet one day receive the diagnosis. This isn't to scare you, it's to help you recognize risk. When you know you're in a high-risk group, you can act sooner. Screening, lifestyle changes, protecting your health. David's story, 40 years of smoking and the price he paid. David, 68, smoked 1 pack a day since age 18. 1 pack, day 40 years, 40 pack years. He came in with chronic cough, 6 kilograms weight loss in 3 months, CT tumor in right upper lung, biopsy, squamous cell lung cancer. David whispered, Doctor, I know I'm paying for 40 years. Smoking, active or passive, is still risk factor number 1. Here are the main groups. Group 1, smokers, cigarettes, cigars, vapes. Smoking, lung cancer risk 15-30x versus non-smokers. More packs, more years, show higher risk. Cigars, pipe, e-cigarettes carry risk too. Some ask, Doctor, I quit 5 years ago, still at risk. Risk, over time after quitting, but heavy smokers, 20 pack years, never return to baseline risk. Still need annual screening. Group 2, passive smokers. Lisa, 55, worked 25 years in a smoky bar. Never smoked. Last year, stage 2, lung adenocarcinoma. She cried, my lungs lived in smoke my whole life. Secondhand smoke, 7,000 plus chemicals, 70 plus carcinogens. Kids in smoking homes, higher lung disease cancer risk later. Quitting protects your family too. Group 3, radon exposure. Radon, radioactive gas from soil, accumulates in basements. Number 2, cause of lung cancer in U.S. after smoking. Smokers plus radon, risk multiplies. One Colorado family tested radon, 3x safe limit, installed ventilation, reduced risk dramatically. Group 4, air pollution exposure. Big cities, traffic, factories, coal burning, lung cancer risk, especially adenocarcinoma. OHU, PM 2.5 particles penetrate lungs. Chronic inflammation, DNA damage. One truck driver, 30 years diesel exposure, later diagnosed. My lungs suffered in silence for decades. Group 5, occupational exposure to carcinogens. Jobs, TD1, RAM1. Coal, uranium mines. Cement, steel, chemical plants. Shipyards, asbestos, metal industries. Asbestos, arsenic, nickel, chromium, much higher lung cancer risk. I treated ex-shipyard workers 20 years after retirement. Many had lung and pleural cancers. Workplace protection, life protection. Group 6, chronic lung diseases. COPD, pulmonary fibrosis, old tuberculosis, chronic inflammation, lung cancer risk. One patient had TB 20 years ago, later cancer in scarred lung tissue. Scar carcinoma. Group 7, family history of lung cancer. Genetics matter. Parents, siblings with lung cancer, to risk. I treated 2 sisters, never smoked, both with rare hereditary mutations. Both developed lung cancer. Family history washed earlier screening decisions. Group 8, age 50, especially men. Risk and with age. Most lung cancer patients 50. Men smoking, higher risk than women, but female non-smoker adenocarcinoma rates rising. I treated a 72-year-old woman, never smoked, lived in polluted city. Stage 2 lung cancer found by chance screening. Why high-risk groups need screening now. Annual low-dose CT recommended by USPSTF, U.S. Preventive Services Task Force. Sashinto, American Cancer Society. American Lung Association. Screening criteria. Age 50-80, Suwater 20-pack years. Current smokers or quit 15 years ago. Early detection, ward much higher cure rates. Common patient questions. I quit 10 years ago, still screen. I live near factories. Am I high risk? My father had lung cancer. Should I worry? My answer. Knowing your risk group helps protect you. Don't wait for symptoms. Final message from the heart. Dear friend, lung cancer spares no one. But high-risk groups need more vigilance. I've seen early-stage cases caught by screening. Patients living healthy years later. I've also seen late-stage diagnoses. Too late for cure. So don't wait. If you or loved ones are high-risk, talk to your doctor about screening today. Next, we'll discuss what happens after a lung cancer diagnosis, treatment options, success rates, and life after therapy. Because diagnosis isn't the end, it can be the start of a journey of hope, science, and courage. If diagnosed with lung cancer, the treatment journey, hope, and strength. Dear friend, over years as a doctor, I've learned the hardest moment for patients isn't the cough, chest pain, or fatigue. It's hearing the words lung cancer from their doctor. I've seen trembling hands clutch test results, eyes filled with fear, voices whispering, "Doctor, is there hope for me? How long do I have? Will I live to see my grandchild graduate?" Today, I want to sit with you as an old friend who's witnessed thousands of stories about what happens after diagnosis. A journey not only of fear, but of science, courage, and small miracles of modern medicine. Robert's story, it began with bad news. Robert, 65, former literature teacher, came in with mild coughing, blood weight loss, CT plus biopsy stage 2, lung adenocarcinoma. He asked softly, "Doctor, do I still have a chance?" I held his hand. Robert, lung cancer is no longer a death sentence like 20 years ago. We have surgery, precise radiation, targeted drugs, immunotherapy, and above all, we have hope. Step 1, staging and overall assessment. After diagnosis, doctors will 1. Pathology, determine exact type adenocarcinoma, squamous small cell. 2. Staging CT, PET CT, brain MRI, ultrasound, bronchoscopy to see if localized or spread. 3. General health check, heart, lung function, comorbidities, fitness for best treatment plan. Because every patient is a unique story. Main treatment options. 1. Surgery, when cancer is localized. For stage 1, 2, sometimes CIA surgery, lobectomy, or segmentectomy may cure if tumor is localized. Helen, 62, had a 1.5 centimeter tumor found on screening. We removed it surgically. 5 years later, she's gardening healthy, sending family photos every spring. Early detection plus surgery, long-term survival. 2. Radiation therapy, the invisible scalpel. If surgery impossible due to health or tumor location, stereotactic body radiation therapy, SBRT offers cure for early cases. Modern radiation targets tumor, precisely sparing normal tissue. George, 75, heart condition, had SBRT remove his 2-centimeter tumor within weeks, minimal side effects. 3. Chemotherapy, the classic weapon. For advanced stages, chemo helps. International shrink tumors before surgery, more radiation, neoadjuvant. Kill residual cells after surgery, adjuvant. Control widespread disease, relieve symptoms. Newer drugs reduce nausea, bone marrow effects significantly. 4. Targeted therapy, precision medicine. 20–30% of lung adenocarcinoma patients have mutations EGFR, ALK, ROS1, KRAS, G12C. Targeted pills act like guided missiles, attacking cancer, sparing healthy tissue. Linda, EGFR plus stage 4 on targeted therapy. 4 years later, traveling Europe with husband, tumor stable. 5. Immunotherapy, awakening the immune system. Immunotherapy helps the body's own defenses fight cancer. Carlos, stage 4, high PD-L1. After 2 years immunotherapy, tumor shrank. He still plays golf weekends. 6. Multimodal therapy, team approach. Many cases need combination surgery plus chemo, plus radiation, plus targeted, plus immunotherapy. Tumor board surgeons, oncologists, radiologists discuss each case. Best strategy for each patient. Chances of success beyond numbers. Doctor, how long will I live? Hard to say, depends on stage, mutation, health. But survival has improved dramatically. Early stage 5-year survival, 50–70% plus. Advanced stage targeted and immunotherapy allow many to live 5 through 10 years versus months before. Modern medicine turns diagnosis into motivation for meaningful living. Life after treatment, not just survival, but living well. Patients need regular follow-up CT labs exams, pulmonary rehab, breathing exercises, walking yoga, Shiranikur, nutrition and mental health care. Mary, post-surgery plus chemo, joined meditation painting classes. Cancer taught me to slow down, treasure each breath each morning. Common patient questions. Can I keep working? Will cancer come back? What foods to avoid? I always say live like a disciplined, healthy person. Eat well, exercise, screen regularly, enjoy each day. Dear friend, lung cancer is no longer the full stop it once was. It can be a comma opening a new chapter of science, courage, and hope. I've seen survivors 5 to 10 years later, traveling, playing with grandkids, writing books, painting, living fuller lives than ever before. My dear friends, we've come a long way together in this video series. From the very first moments when I shared with you about lung cancer, how to tell it apart from other conditions, the different types, the causes, the dangers, ways to prevent it, who is at high risk, and even the treatment journey, all of it came together like a big picture we've painted side by side. Today, as we reach the final part, I don't want to just repeat facts. I want to leave you with a heartfelt message from the perspective of a doctor with over 30 years of experience treating lung cancer patients, and as someone who has witnessed not only tears and fear, but also incredible courage and hope. The story of Eleanor, the woman who never gave up. I remember Eleanor, 64 years old. She discovered stage 2 lung cancer through screening. When she held the results in her hands, she told me, "Doctor, I already lost my husband to lung cancer. I don't want my children to lose their mother too." We operated, gave chemotherapy, and followed her closely. 5 years later, Eleanor was still healthy, joining cancer support groups, inspiring countless others. She tells newly diagnosed patients, cancer is not the end. It can be a comma, giving you a chance to live a more meaningful life. Eleanor's story reminds me this journey is not only about medicine, but also about human resilience. Why I want you to take action today. I have seen patients who found their cancer early through regular screening. They had surgery, finished treatment, and returned to normal life, even healthier than before. I have also seen patients who ignored a persistent cough, weight loss, or chest pain, only to arrive when the cancer had already spread far. At that point, treatment could still extend life, but the chance of a cure was almost gone. You see, the difference lies in when you take action. Things you can do starting today. 1. Quit smoking if you smoke, and avoid secondhand smoke. 2. Test your home for radon if you live in a high-risk area. 3. Eat healthy, more vegetables, fruits, fish, whole grains. Limit processed meat, fried foods, alcohol. 4. Exercise, brisk walking, 30 minutes daily. Deep breathing, yoga, or swimming. 5. Stay positive meditation journaling, talking with loved ones, joining community groups. 6. Get screened if you're high-risk age, 50, 80, 20 plus pack years currently smoking, or quit 15 years. Every action reduces some risk, and every reduced risk is a chance for you and your family to live healthier. The story of Mark, From Fear to Peace. Mark, 70 years old, was diagnosed with stage 3 lung cancer. At first, he was terrified. He asked me, "Doctor, how much time do I have left?" We started chemotherapy, then immunotherapy. A year later, the tumor had shrunk, his health greatly improved. Mark learned meditation, ate healthy, and walked every morning. At his third-year checkup, he smiled and said, "Doctor, I've never lived this peacefully before." Mark's story shows science gives opportunities, but your mindset decides the quality of those opportunities. The message I want to leave you with: my dear friends, lung cancer is scary, but we are not powerless. Modern science offers many advanced treatments: surgery, precision radiation, targeted therapies, immunotherapy, helping patients live longer, healthier lives. But beyond science, your one-own action is the key. Take prevention seriously. Get screened. Treat early. Because health waits for no one. Please share this message. If you find this video series helpful, please share it with family and friends. Someone may need it. Leave comments with questions or your story. My team and I will listen and respond. Subscribe so you won't miss future videos on health, nutrition, and prevention. We're building a health-loving community where people no longer fear because of ignorance, but act with knowledge and confidence. Final words from the heart. I'm Dr. Mark. Over 30 years of working with lung cancer patients, I've realized one thing. Life isn't measured by the years we live, but by the moments we truly breathe deeply. Start today with a deep breath, a healthy meal, a checkup, a warm conversation with your loved ones. Because health is the greatest gift you can give yourself and those you love. Specific calls to action. If you're over 50 and ever smoked, talk to your doctor about low-dose CT screening. If you smoke, make a plan to quit today. If you're healthy, keep living healthy so health never becomes your regret. And please don't forget, like this video if you find it helpful. Share it with family and friends. Subscribe for more science-based, simple, and inspiring health content. My dear friends, this journey doesn't end here. It only begins from knowledge to action to a healthier, more meaningful life for you and your loved ones. See you in the next videos where we'll continue talking about health, nutrition, and prevention with science, warmth, and humanity. I wish you peace and good health.